Good morning, world.
Good morning. I'm sure you guys are all familiar with the term, stay in your own lane. That can't be more applicable than the next two videos you're going to be watching. We're going to talk about COVID, some numbers, what causes it, what doesn't cause it, comorbidity, and other things. And that is all in Brian's wheelhouse, and I will chime in whenever possible. I'm Cedric.
And I'm Brian, and this is Cedric and Brian.
Okay, welcome back. We're going to talk about COVID and some of the underlying things that can help you with COVID. One of those things I'm going to jump right into is food. But what would happen if we didn't have enough food?
I don't know, but it's starting to feel real kind of scary now.
Yeah.
Feeling really bad, and I think now is the time, just in case. And I don't want to be a doomsdayer. Doomsdayer. But why not be prepared?
So if it does, like Brian says, are you prepared? Do you have enough food, water, and other essentials to get you through tough times? If not, check out My Patriot Supply. They're the nation's #1 preparedness company, and they've served millions of American families just like yours. Right now, you can save 25% off their popular 4-week emergency food kit, which will keep you well fed for 4 weeks worth of breakfast, lunch, dinner, drinks, and snacks, totaling over 2,000 calories a day. This food stays fresh for up to 25 years in proper storage, so it will be there when you need it. In fact, you may need it a lot sooner than that.
So don't wait. Go to www.preparewithcedricandbrian.com. www.preparewithcedricandbrian.com and get 25% off. And remember, this stuff has a 25-year shelf life, so hopefully nothing happens, but it's always better to be prepared.
Like I say, if you stay ready, you ain't got to get ready.
That's right. All right. So now we're going to get into this episode. So I've been sitting down doing more research. Obviously, I'm in the healthcare field, so COVID is just in my face every day. You can't avoid it. And so I'm going to do a little episode called The CDC Data May Surprise You. Right here, who dies from COVID and why? Okay. So, and Cedric, I told him kind of what I was talking about, so you're going to get kind of his reaction to what I bring up here. Okay. So I just want to let you know, I got a lot of this information from a YouTuber because it came across my YouTube recommended just because of the stuff that I researched. And it's a guy by the name of Chris Mortensen right here, and his channel is Peak Prosperity. So if you want to get really into the weeds, because he gets into the more of the medical data, that's more in his wheelhouse, go to his channel. I will put a link to the episode that I got a lot of my information on, so please go give him a shout out. If you like this episode, you can get even deeper in his episode. All right? Let's get going. So, the numbers that I'm getting, that Chris got, they're from the CDC. So, there's different sites, and it'll all be cited here. Basically, this is an article that came out, and Cedric can see this too. It's Preventing Chronic Disease, Public Health Research, Practice, and Policy. So, this was July of just this past year, so just last month.
Okay.
We're now into August. You can see the link is there below it, so you can get the study right from the CDC website. So, don't take me down. This is not misinformation unless you're going to consider CDC misinformation, which you may. So this is where I got the study from. So basically they took between March of 2020 and March of 2021, they took almost 5 million hospital cases, so hospital stays. Out of those 5 million, 540,000, so almost 541,000, you can see the numbers there, were COVID. So patients with COVID-19. So, again, we don't know, were they diagnosed?
And these are just general hospitalizations.
Yeah, so this pool is from 5 million, so 4,899,000. So it's a big pool. It's a big, some of these studies, they 37 people,
right.
Like the drug that we shall not name. The studies that they debunked had like 37 people in it. So this has 5 million, and of those, you've got over 500,000 people with COVID. Okay, just taking that for what it's worth. So right there, 94.9% of these in this study had at least one comorbidity of the people that had COVID. And we'll get into the weeds of that a little later.
Now, do you want to explain what a comorbidity is?
I'm going to get into that.
Okay.
So I just want you to just read this real quick. The highlighted stuff is what we're going to get into. But you can see the strongest risk factor there, and we've been saying this for a long time, is obesity. All right. The second one, which was interesting, which I'll get into in a bit, is anxiety and fear-related disorders. So I'll dive more into that. And then the other one down there is diabetes with complications. And that with is very important to distinguish with just people that have diabetes. Those numbers, 1.3, anything at once, I'm going to explain this really quick. So 1 would be these people in the hospital, they have an equal chance of dying in the hospital with or without COVID. So if it's 1.3, that means the people with COVID and these comorbidities have a higher than average rate of dying.
30% or?
Yeah, so basically 1.3, so you got 30% more chance of dying if you have one of these diseases. All right, so we'll just move along here. And I already mentioned the strongest risk categories. All right, so let me just explain this to you really quick. So you've got these people from the number that I told you, you've got the 500,000 people, and they did a study. Okay, how many died? How many had IMV? Now, IMV means they were put on a ventilator. So they were put on a ventilator and didn't die. And then you had just the ICU admissions. So we're going to stick with death because that's really what we care about, right?
Right.
We don't really know long-term about COVID or the vaccines yet because it just hasn't been long enough. But we all understand death. So as I stated before...
And the ones on the left, they're listed in order of...
Yeah, you basically, that full model right there on death. So let's just start there. So obesity, as I mentioned, 1.3. So basically you have a 30% chance of dying
if you're obese.
Of COVID if you're obese. 30% higher than average. Anxiety and fear-related disorders. Okay, it's interesting. Nobody hears about that.
No.
And this is independent of age, so I want to make that clear right now. They're not looking at age at this point. This is just, you could be a 30-year-old morbidly obese or obese. Okay? Then you got diabetes with complications, and you can just go down the line there. You can see it gets less and less and less. Thyroid disorders, you barely have a higher risk factor of dying from COVID. So here's some not so bad, because other people think, I have diabetes. Is that going to put me at a higher risk?
Right.
So if you look here, it's actually less than 1, so it's 0.94. So you have a slightly less chance of dying with that comorbidity. So those of you who have controlled diabetes, don't stress too much.
Exactly.
Again, all the media has been doing is putting fear out. I'm just trying to give you actual numbers taken right from this study. So take it for what it's worth. This is the chart that you really need to worry about. And so we're going to go on from here. And I want to talk about this because obesity, everybody knows what obesity is. And we'll get to that at the end, where the BMI comes in. So anxiety and fear-related disorders. So I'm going to read you something here. And bear with me when I read this. Anxiety and fear-related disorders were a prevalent condition in our sample. They were also the second highest risk factor for death among the underlying conditions considered in our study. The reasons for this finding are likely multifactorial and may include a reduced ability to prevent infection among patients with anxiety disorders, the immunomodulatory and or cardiovascular effects of medication used to treat these disorders, or severe COVID-19 illness exacerbated these disorders. And what's important is below that you say in a subset of patients with pre-COVID encounters in this study, anxiety diagnosed for COVID-19 was not independently associated. Okay, so I'm just going to break that down. They didn't break down to whether the people had a diagnosis of an anxiety disorder before COVID or if having COVID brought these disorders on.
Okay.
So what they're saying is maybe some of the medications for anxiety made it worse, but they can't really prove that. Here's my conclusion. So here's where I'm going to come in and give my opinion. So separate from this, all we've gotten during the last year and a half is this is going to kill you. Fear, CNN fear, right? They had the ticker while Trump was president, not while Biden was president. While Trump was president, they just kept ticking the deaths. So now you're scared. So now you get diagnosed with COVID, enough to go to the hospital. Now you're afraid to die because that's all they tell you, even though it's a point, whatever chance of dying. Now your anxiety goes up. stress levels go up, your cortisol goes up. We know what stress does to the body. Stress is a killer. Before COVID, we knew that stress is a killer. It causes high blood pressure. It causes all sorts of things. So I think, again, this is my opinion, that the reason it's second after obesity is because we created so much fear that when you're in the hospital, your stress stuff is going through the roof.
Yeah.
So I think right there, we need to control anxiety when we get to the hospital. So let's say you have some kind of phobia, whatever it may be. Maybe one of the first things they should do if they see you have anxiety when you go to the hospital with COVID is give you maybe an anti-anxiety medication.
Right.
Bring that, and again, I'm not a medical doctor. I don't know if giving that anti-anxiety medication is going to help with your cortisol levels and all that. I would think it would, even if they just, if it cause you to pass out. Whatever the case may be, bring the anxiety level down. Maybe that anxiety won't be the second comorbidity.
Right.
That's my 2 cents. All right, so let's go to this. The sickest people did the worst. And what I mean by that is if you look at this chart, out of the 540,666 people that had COVID, if you look over there, only 740 people died that had no pre-existing conditions, no comorbidities. Okay, and that's that number over there to the right. All right, so 740, which is 0.9%. Now, these are people that are already in the hospital. I'm not saying you have a 0.9% or 0.9 chance of dying if you get COVID. These are hospital cases in this study. Look at this. If you have 6 to 10 comorbidities, you have a 39.1% chance of dying. 31,000 of those people died out of the 540. For 10 or more, 20,000 people. And at 2 to 5 comorbidities, 25,000. So you take those numbers, those are the people that died.
Right.
The rest, if you only have one comorbidity or 0, you have, at 2.6, you have 3.4% chance of dying if you're already in the hospital.
Yeah.
That's it. So what's the bottom line? Health. Stay healthy. Don't have these. Now, the one thing about this comorbidity, again, we don't have the age. We don't know the ages of this. So the 740 people with 0, those could have been 740 people in their 80s.
Right.
We don't know.
Right.
We don't know.
What, do you think that information is hidden on purpose?
According to Chris, he said he scoured it and he couldn't find it in that study.
Okay.
Maybe if you search, if somebody else has more data, let us know. All right, so we want to go to the number one reason that people die from COVID. Probably the number one reason in general, I would assume.
Oh, yeah. Yeah.
But from COVID, because that's what we're talking about. You have to have a BMI of below 30. Anything 30 and above, they consider obese. Now, what they also didn't do is they did not break it down, well, how obese? Were you at 30? Were you at 40? Were you morbidly obese? Were you 600 pounds? They didn't break it down. They just said obese, okay? Which we know, that's the number one. So you could just be barely obese, and you made that chart. So I was going to joke with Cedric here. Me and him are about 5'10". He wants to pretend he's taller, but he's 5'10".
A little taller.
Remember, we're shrinking. So to reach obesity, we would have to be 210 pounds. So we are not considered obese. Cedric, though, he's been working out hard. I think he's about 180 pounds. He would be considered overweight by this chart.
What?
But the problem with this chart, again, when I had 9% body fat at one point and weighed about 180 pounds. So again, 9% body fat, I don't think I was overweight.
No, right.
They don't take into account muscle weight. So I think that's why this chart has gone up a little bit. But you can have some muscle-bound guys that would definitely be listed as overweight. But if you're 5'10 and you're 210, 5'10 and you're 210 pounds, you're probably obese. I don't care how strong you are.
Right.
If you are, you're probably carrying too much muscle for your body frame. So anyways, I just wanted to bring that up. Look at this chart. Make sure you don't fall into that, and you've got a much better chance of survival.
And not to steal your thunder, but are you going to get into why is the government pushing the vaccine and not pushing fruits and vegetables and exercise? And
I'm going to get into that.
Okay, I'm stealing your thunder. Okay, go ahead.
Wow.
Sorry.
Boy, I might as well stop now.
No, just go ahead.
Kidding. Okay, so what does the government really care about? And the media. I'm just going to put the government and the mainstream media together because at this point, if you're a Democrat, you're the same party. So here's the thing. Remember, obesity is the number one comorbidity on this list. Look at what they pump. This is the mainstream media.
Yeah.
All right? This is Cosmopolitan. Remember Cosmopolitan back in the day?
Yes.
Always had hot girls on there, right?
Right.
That's what you saw. You saw healthy looking, and they weren't the skinny model looking. They were usually healthy workout type people. This is what they're pumping now. Just look at the screen. Does that look healthy?
Well,
but according to Cosmo, this is healthy.
Back in our day, you look at a Cindy Crawford or even a Tyra Banks. They weren't small women.
No, I mean, Tyra was much skinnier than Cindy Crawford. But yes, so here is the problem with our media right now. And I'm just going to use media as a blanket. I'm going to, anywhere from commercials to magazines to TV shows, this is what they're promoting.
But this is the trick we talked about in our last video about how you were joking about how you could make a comment about the animated video we watched because then you're being racist. We can't make comments about this because now we're body shaming.
Yeah, exactly. So that's where we've come to. Even though, again, the number one comorbidity, cause of death from COVID-19 is obesity. Both these women on the cover are obese. So do we really care about health? They don't care about health.
And here's the thing, I'm not saying that they're ugly women.
No, but they're not healthy.
But they're not healthy.
They definitely will be in a higher category of getting of having a bad outcome from COVID.
Yeah.
But that's why I said, not only the government, but mainstream media does not care about health. They always try. You hear what was it, Cuomo? Should we even talk about Cuomo now? If we prevent just one death, well, if you really wanted to prevent death, then there's other things that you can talk about.
Yeah. Old folks' homes.
So now let's get into age. So age matters. I'll kind of explain these numbers here. The blue line was done up until April 20th of 2020. So this is older data. The red one is May 4th to June 30th of 2020. But if you looked at, you can see it's almost a straight line as we age from 30 years old up to, they have 90 there. It's almost a perfectly straight line. And when you do a measurement, that little math calculation there, even though math is racist, it's saying that every 4.82 years, you have twice as much chance of dying of COVID. So for almost every 5 years you get older, you double your chances just on age. Now that doesn't take in comorbidities. So again, they did the comorbidities and then they did the age. It would have been nice to mix them.
Right.
So now look at the red though. We learned how to treat it better just within that short period of time. So the rates are lower because the lower it is on that chart, the better your outcomes are. And you can see it's almost 5.5 years. So every 5.5 years, your chance of dying double.
Now that takes in that's just the natural progression of father time.
Yeah.
It isn't taken into consideration if you work out, if you eat well.
Nope. Okay. That's just your line right there. You can see a weird jump around 42, it looks like. It looks there almost like your chances at 38 and 42 are the same. So that age group, it doesn't seem like your morbidity changes at all. It's interesting. Interesting crunching numbers. All right, so the number one goal of the government, if they care, is to get people healthy, to encourage people to get healthy.
Yeah.
What are they doing now? First they encouraged people to get masks.
Yeah.
That was, mask up. And now they're encouraging.
Get the shot.
I use encourage. We'll get to that in our second episode. And I use encourage people is a little bit different than it used to be.
Yeah.
So besides age, obesity and underlying conditions are the most important thing. Sorry. A little froggy. Yeah, so you better stay away. I better mask up.
All right.
So not only diet, but nutrition. So it's not just staying thin, but you have to have you can be a skinny, starving person. You're not healthy. You have to have the right nutrition. So you got to make sure, and they've been talking about making sure your vitamin D, and we know now, not only is vitamin D important in COVID, it's important through just your health, through other disease processes. Vitamin C, all the water solubles too, because you can't keep them. You have to get them from external sources. So
I remember me and your wife talked about that a couple of months ago about us both being skinny, fat people at one time.
Yeah. So, all right. So let's go back to, I'm just going to bring up a little bit of the vaccine debate right now. I'm going to get more into it in part 2 of this. That's going to come out next episode. Not everyone can get vaccinated. So I know we're trying to create this 2-class system, but not only can people not get vaccinated for medical reasons, But some of them had such a bad reaction on their first dose that they can't become what they call fully vaccinated because their doctors say, you better not get that second shot because you could die. We know now there's already, just in the United States, there's already over 10,000 deaths due to the vaccine. So I'm not going to get into the whole vaccine thing in this episode. You can watch that on my next episode, what the government, everything is doing to us. And number two, this vaccine isn't even FDA approved for public use. It's emergency use only, which again, they don't tell people, and they're pushing this like this is the smallpox vaccine. This is not the smallpox vaccine. Again, look at the numbers coming out of the UK and Israel about the Delta variant, and I'll get into that more next time. And then, I just want you to know, we are not anti-vaxxers.
No.
I had plenty of childhood vaccines. Mm-hmm. We've both been vaccinated. And I'll get more into that again. I'm just kind of pimping our next episode. That's going to be all on the vaccines and what the government's trying to do. But I just want to let you know, we're not anti-vaxxers, okay? I know people try to give us the label, or anybody who talks about COVID or and vaccines. But we'll get more into that next episode. I just wanted to give you the numbers and what really matters. If you're healthy, the chance of you dying of this, and we say this over and over again, if you're young and healthy, you're not going to die. Yes, there are outliers. Yes, and you'll find every outlier because the mainstream media will find every healthy 30-year-old that died from this, and they'll put them on the news. Or they'll do even worse and say, I told you so, and just, would you ever say that if somebody who died, I told you so?
No.
But they do that. People do that now with this coronavirus. It's sick. So we want to just let you know, use common sense. And this is just kind of my intro. The next video is going to get all into the numbers with the vaccines and everything. Don't miss that episode. That's coming out next.
Right.
All right.
All right. Well, hope you guys learned a lot from that. I certainly did. Like I said at the beginning of this video, you got to stay in your lane. Brian is in the healthcare industry, and I've learned a lot over my 20 years. He was my first coach as far as weightlifting, and it's kind of hard going to parties with him, though, because he gives me the evil eye whenever I pick up something to eat that I shouldn't be eating. So I try and stay on the other side of the room when he's around.
Come on, you can throw me under the bus. I just fed him pizza today.
I know. We had pizza, and I was for lunch. You were running late. But anyway.
But we're just pointing out, if the government really cared about you, we would be promoting health, not vaccines and masks.
Yeah, or we would get rid of cigarettes and alcohol and things like that, but they promote that. Or they don't stop it anyway. Yeah. Anyway, hope you guys learned a lot. Make sure you stay tuned for the next video coming up next Tuesday. So stay tuned for that. But make sure you like, subscribe, ring that bell, and share our videos with everyone you know. And please continue being good to each other. Until next time, I'm Cedric.
And I'm Brian. See you later.